Go back to what I started at the beginning in relation to a health service and whether you have adequate funding and whether the collateral damage of people being on trolleys and so on and long waiting list. Now, I left this room to take a phone call, which is very unusual for me. And the phone call is to the effect that for the fourth week, almost in a row, the fourth person has been refused admission to the psychiatric unit in Galway, threatening serious harm to him or herself, I won't identify. And this is the fourth week in a row almost that they have been refused, a different patient each week. Now again, this is not asking you to comment on one specific person, but this is an ongoing saga in the psychiatric unit in Galway. It is not fit for purpose. They are refusing people who are seriously ill. The Mental Health Commission has gone in. I started off my contribution by pointing this out. I'm finishing my contribution by saying, Mr. O'Brien, how can you stand over a health service with that budget that's refusing people in crisis in Galway City, literally being turned away from the door? Has it been brought to your attention over the last number of weeks? Have urgent representations been made to you? Are you aware the Mental Health Commission have gone in again, unusually so, in addition to their annual visits?
You have a multi-part question there. Am I specifically aware that somebody was refused admission this morning, last week, the week before, the week before? No. Am I aware that there's engagement between the Mental Health Division and the Mental Health Commission in respect of Galway? Yes.
Are you aware they're in an acute crisis stage where they're being forced to not admit people?
I'm aware that our mental health service is challenged in a number of locations. I'm not going to speak about Galway in particular, but we do have an issue with our mental health service capacity, which is very acutely connected to our capacity to recruit mental health professionals.
Okay. So at the moment, it's collateral damage that people cannot get admission to a psychiatric unit in a centre of excellence. That's something they just have to put up with?
Yeah, I keep hearing this word, centre of excellence.
Yeah. That's what it's been called by yourselves.
No, we don't use the term.
It has been used repeatedly at the Health Forum in Galway. But in any event, let's not argue over a term, but it has been used repeatedly. So that's the position in Galway. You're fully aware of it.
The term was first used in relation to cancer care services. It's not a generalised term that relates to Galway or anywhere else.
Good.
Anywhere that purports to be a centre of excellence, I think, is asking for trouble.
That's right.
Health services should always be improving, never satisfied and always changing, and calling yourself a centre of excellence is just daft.
Well, it's certainly daft that a health service that has 15 billion almost and a psychiatric service that's refusing patients admission as we speak.
I'll take you back to the first conversation we had in this part of the meeting.
We didn't have a conversation. I tabled you some questions, actually.
Well, in most civilised environments, when two people talk to each other, they regard it as a conversation.
Mr.